Welcome to episode 13 of the Health Revolution podcast. I'm so excited to have my amazing husband, Dr. Jon Peterson, here with me today.
Hello, hello.
Jon has become quite the expert on our topic today. We're going to be talking about CBD, some benefits of CBDs, and common misconceptions. And thanks for joining us today, Jon.
Absolutely. I'm really excited about this topic, actually.
I know you're passionate about it. Right now we're in July and we're just on the home stretch of getting those kiddos back to school.
And it's 115 degrees
Only
today.
115. Jon took me on an amazing bike ride the other day.
It was great. It was great. It was an adventure, I'd like to add.
Oh, a 9-mile bike ride turned into 16. Mm-hmm. And I have all sorts of cuts and bruises and emotional wounds as well from that bike ride through the desert, not on a trail. I am not a biker, you guys. But Jon's going to make me one, whether I want to or not. And, I survived. That's the point. I'm here. I survived and I haven't murdered my husband yet. So all is good. Mm-hmm. Jon, so today we get to talk about plant-based medicine. We've mentioned it on the podcast before, but we haven't gotten into it specifically. What does that mean when we're talking about plant-based medicine?
Well, it's basically using things of the earth as medications and not resorting to a pill that's made in a factory.
Okay, so what types of plant-based medicines, like herbal supplements?
They can be herbal supplements. They can be oils from certain plants. It can be a number of things. I mean, even something as common as oregano that's found in your cabinet in your kitchen can actually be a medication.
Yeah, I was just studying about turmeric this morning, actually.
Oh yeah, and turmeric's great.
Yeah, you've been studying about that as well. So CBD. When did you start learning about CBD and its benefits?
So I started studying a little bit about CBD about 5 years ago.
Okay.
I would say probably, somewhere thereabouts. 5 years ago is when I started studying it and actually taking it myself. But, I'm a little bit of a skeptic. I don't really want to jump in and just take something just because somebody says it was good. I always go to the literature and go to the research and find out exactly what it is that this thing can do.
Yeah, tell us about, I guess, what CBD is, what it stands for, all of that.
Okay, so CBD is derived from the cannabis plant.
Okay, so like when people say that, they think marijuana, right?
Yeah, there's a stigma around that if I take CBD, am I going to get high? No, you don't. Most CBD actually comes from a species of a cannabis plant called the hemp plant. Mm-hmm. And so it tends to be very high in this medicine that we call CBD and very low in another medication, which is a medication indeed called THC, which is psychoactive. So that one will actually get you high.
Okay. So when we talk about CBD, it doesn't get you high, right?
No, it does not.
The THC component of it's the same plant or it's not the same plant?
They can actually be derived from the same plants. It's just when we go to certain cannabis plants, they tend to be a higher percentage of CBD and perhaps a lower percentage of THC and vice versa. Some have a higher percentage of THC and a lower percentage of CBD.
Oh, I didn't know that. So there's different kinds of
many strains of cannabis plant. Yes.
Okay. All right. So if you see something like at the store and it says CBD on mm-hmm. it,
to be sold legally in the U.S. as CBD, it actually has to be 0.3%. It can't be any higher, rather, than 0.3% THC, which is nothing.
Okay. So CBD is legal across the entire United States. Like CBD isn't.
Absolutely. It can be purchased over the counter in many stores.
Right. But THC is legal in some states or some places. So
now on a federal level, THC is illegal.
Oh, okay. Because that gets you high.
Because that gets you high.
All right. And then THC, if you're getting drug tested CBD, if you're getting drug tested, does that still?
It actually shows up in your system. And so, it raises a question. For instance, One of a patient of mine I was talking to, she works in the prison system, and as a result, she's drug tested regularly. And if she were taking CBD as a supplement and she got a blood test, it would pop that perhaps she had been using THC to get high.
So even though that didn't have the reaction in her body, the blood work could still show positive for THC.
Yes, and it would raise questions.
Okay.
And so if you're working, for instance, like a federal prison system, they ask you not to use CBD because they don't want you to pop positive on a drug test.
Gotcha. Okay. That's good to know. Yeah. And I think it's good to know that it's totally legal. And as long as you said it has that less than 0.3 THC.
Absolutely. And it's not intoxicating, and it does not cause a euphoric high like its cousin, THC.
Okay. Very good to know how to separate these. I'm glad we're going through the misconceptions, and then we're going to talk about the benefits in a little bit. So is it a cure-all? That's my next misconception, because I hear like everybody's like, oh, just take some CBD and that problem will go away. Like any problem in the world, they're like, just take some CBD and it'll be fine.
You know, if we begin to use CBD the way that pharma prescribes pills, I think personally that's a problem. I don't think that CBD is a cure-all. I think CBD can be a help-all.
Okay, why is that?
Because it has, CBD operates in the body and basically elevates the functions of all of your organs inside of your body.
Really?
Absolutely.
How does it do that?
There's receptors on every cell in our body. They're called a CB1, a CB2 receptor, and CBD interacts with those, and it changes the way that the cell functions.
Wow. So it might not cure. And I think with most medicines and plant-based medicines and all that we're talking about, it's really hard to say it will cure something, right?
Yeah.
But it'll
the cure-all, I would say, is lifestyle change.
Yeah.
And healthy living and clean eating. But CBD is a help-all to where, for instance, if you had been living a life, hypothetically, let's talk about the arthritis in my finger. All right. So I've got arthritis in my finger from an unhealthy lifestyle of working 80 hours a week and doing surgery 80 hours a week. As a result, it took a toll on my joint, particularly one of my fingers, and it hurts. But if I take CBD, it actually helps that joint. It doesn't cure it, but it helps it feel better, and it prevents my arthritis from getting worse.
And does it have like side effects when you take it?
Not at all.
Yeah,
I just feel better.
Right. Oh, that's terrible.
I know. It's a terrible
thing. That's awful. So, as long as you're taking it, is it like lubricating your joints, or what? Well, you're taking it topically or orally?
Without getting into the science of it, you can actually take it topically or orally, and it can have similar effects, which is neat. And for instance, a rash on the skin, you could actually put CBD directly on that, and it can help just that rash. But it also seeps in and helps everything else out.
Oh, nice. I know you're saying that you use it in your practice for people with like mouth sores. Right?
Absolutely. Yes. Yeah. We use it for mouth sores quite a bit. So when patients come in with stress ulcers in their mouth and whatnot, we can actually give them a CBD rinse to use.
Wow.
And that heals them. And I haven't found anything else that's capable of doing that.
Are you serious? Like nothing in big pharma or nothing, no other?
Not that has had the effects that CBD has.
Wow.
We have been able to prescribe steroids, which are terrible for the body.
Oh, yeah.
That can help. Steroids definitely help, but it also takes a toll on the rest of the body.
Yeah, and aren't we kind of limited to how much?
Absolutely. Yeah. I don't recommend steroids for any more than about 2 weeks.
Okay. So, all right, that's really good to know that. And I think with CBD, saying it's not a cure-all, like how I've noticed it working in my life is like with my sleep and with my stress, but it's not just going to make that better. It's not going to make my sleep better automatically. It's not going to make my stress go away automatically.
No.
I still have to do like my breathing and meditation, and
you got to put in the work.
Yeah, put in the work. But I've noticed it can amplify the progress that
Absolutely.
I'm making
Absolutely.
with all of that.
I mean, for sleep, pharma gives you an option of what? Unisom.
Ambien, Unisom, yeah.
Okay, Ambien is the prescription,
Right.
and that was terrible. Or if you're going to go buy an over the counter, you can get Unisom. Well, Unisom is essentially just supercharged Benadryl. And Benadryl, if you're taking that to sleep, it may help you initially get to sleep.
Yeah.
But it drastically affects your REM sleep and your deep sleep.
Yeah, I talked about this in podcast 10, I believe, where we're talking about big pharma overprescribing and the side effects of taking too many pills. So that's an interesting podcast to go back to if you are interested in more information about that. Mm-hmm. So is CBD addictive? Well, that's another misconception I think a lot of people have, is like, I don't want to get hooked on something or be like reliant on something. So talk to us about that.
Okay, so I'm going to talk about CBD and THC here, if you'll allow me.
Yeah.
CBD and THC are both non-addictive.
Okay. So THC, the one that gets you high, and CBD, the one that just elevates your mood or whatever.
Yeah. I mean, when I talk about an addiction, we're talking about something that it's eliciting a physical need for that drug.
Right.
Now,
or like you'll have withdrawal symptoms if you stop taking it.
Yeah. Now we can have an emotional want
for
that, but it's not accompanied with a physical symptom. Does that make sense?
Right.
Okay.
Yeah. Okay. So there may be like a dependency on THC. What does that still happen with CBD as well?
Not at all. No. CBD, once CBD leaves your system, CBD leaves your system. The reason why THC might require an emotional want for it is because it gets you high. I mean, you're there. You're happy.
You forget about life.
You forget about problems.
Yeah.
And that feels really good. But it's not, if you stop taking THC, it's not a terrible thing.
Okay.
Like you're not going to go through withdrawals like what you might by withdrawing from Xanax or withdrawing from opiates or any of those things.
Yes, as you've had a lot of experience with both of those.
Absolutely.
Before.
We should do a podcast on that.
Okay. Going through withdrawal symptoms of big pharma. Oh, that's good. So that's really good to know, though, because so much of big pharma, we do get those withdrawal symptoms. We get the dependency and all of that. And it's really hard to come off of a lot of those. So
they want you as a customer for life. And so that's what they're getting.
It's a great business model.
Mm-hmm.
Okay, so are all CBD products the same? That's another question that comes up a lot, because you can see, I've seen CBD in all sorts of forms. And
shoot, I just went to Circle K.
Yeah, I was gonna say, like at the gas station, there's like CBD gummies and CBD cookies and CBD. I don't know. It seems like it's everywhere.
All right. So now, the whole idea is CBD is not CBD is not CBD. CBD is grown from a hemp plant.
Right.
But it's very important that where it comes from, where it's sourced from, that company is then doing third-party lab testing.
Okay.
So they're actually using an alternative company to test their product to see exactly how much CBD is in that and in what forms it's coming. A lot of the CBD on the market is crap.
Really?
It absolutely is.
Meaning what? Like it just doesn't do anything?
Well, first off, number one, you're overpaying for what you get.
Okay.
For instance, if I went to Circle K, I just went the other day to get some fuel.
John loves Circle K, by the way. We're not poo-pooing Circle K.
Used to. I'm learning not to.
Because of your soda addiction.
Oh yeah.
So you got out of your soda addiction and you're a little bit less of a Circle K customer.
Absolutely.
Okay. That's not a problem. Okay.
But I still go there to get fuel.
Right.
So, but while I was in there, I saw CBD in their window, so I decided to check it out. And they have these great gummies in there that are 25 milligrams of CBD.
Okay, that seems good.
Yeah, it seems good when you think about it, but essentially you're just eating a sugar pill because 25 milligrams of CBD isn't enough to do anything.
Oh, okay.
Yeah. So you pay, for instance, $20 for this pack of, 6 gummies.
And you'd have to take the whole
You'd have to take nearly the whole package for it to benefit you.
And that's like a ton of sugar.
Oh, a ton of sugar. Ton of sugar.
Okay, and then but would it benefit you, or would the sugar
if you ate the whole pack
like
for $20? Absolutely.
Oh my gosh,
$20. Yeah, so the companies are realizing that they can slap CBD on their labels and make some money. So it's important to make sure that you're looking out for where your CBD is coming from. Like, and I that actually led me to begin mixing my own.
Yeah.
And so, I personally went to a farm and made sure I knew what product they were offering, and I buy their CBD powder in bulk, and then I make my own products. And I know exactly what's in it because I have the third-party testing.
Oh, nice. Yeah, and I've seen Jon makes these vials. We actually sell it in our shop on our website, but he makes these vials of CBD oil, and he gets the really good quality olive oil. He's sourced that as well.
Yep.
Make sure that's from a reputable manufacturer. And then he sources the CBD isolate. Is that what's called?
It's the CBD isolate. It comes in a powder to me. Yeah.
And then mixes it up in small batches and then distributes it out into these vials. And we sell that to our clients, and he also sells it to his patients at work, and we give it to family members. And I've never heard of someone having a bad experience. And in fact, a lot of people just keep coming back for more because it's so helpful. They've been able to get off of a lot of their prescriptions and just take the CBD. They've noticed a lot of benefits. We're going to get into those in a little bit. We have one more misconception I want to talk about first, though, and that is, does it have immediate benefits, CBD?
Immediate by what do you mean by that?
I mean, like
if I start taking it now
for your finger, you're saying like for your finger, your arthritis in your finger, if you take CBD, does it immediately help your finger, or do you have to take it for like a few days or weeks?
Actually, that has an immediate effect for me. And it does help my joint feel better. CBD, if you take that internally, it takes about anywhere from 40 to 90 minutes to actually take effect in the body and start to affect the cells and the way they function. And so, yes, that can take some time. Now, it depends on what we're taking that CBD for.
Right.
If we're taking the CBD to help with depression, for example, it may take a few weeks of taking that CBD before you start to notice the effects.
Got it.
For arthritis, patients notice almost immediately. If the patient is taking that for ulcers or a rash, it may take a couple of days for that to take effect. Absolutely.
And does it vary from person to person?
It does. It's based off the biology of everybody's body.
Yeah.
Everybody's different. And so even your dosage of CBD might need to be different from person to person.
What is the dosage that you recommend?
Well, I standardize my CBD at 100 milligrams per dropper full. And
okay. So let's talk about that for just a second.
Okay.
You said the gummies at Circle K are 25
milligrams
gummy.
per gummy. Yeah.
And so you say just like with one squeeze of the CBD, one squeeze of the oil, it's olive oil. And like, I think it's how many, like a teaspoon?
It's 1 milliliter. It's less. It's a fifth of a teaspoon.
Okay. So much better for you than a sugary gummy. And then you're getting 100
milligrams of CBD.
Okay, awesome.
That's where I recommend starting is with 100 milligrams of CBD standardized.
All right, and like the way I take it is before bed, and I don't like the taste of olive oil. I'm a big
I'll mix you some with avocado oil.
Oh, I love that.
Okay,
avocado oil has a lot less taste to it, but I just like put water in my mouth and then drop it into like the back of my throat and then do a big swallow because I'm like a 5-year-old when it comes to taking.
You could just take a dropper full and put it on your belly and rub it in.
Really?
Absolutely.
Oh my gosh, why am I not doing that?
I have no clue.
Okay, let's talk about the 7 benefits you've come up with of taking CBD. The first huge one being pain relief.
Oh, absolutely.
Okay, tell us like what kind of pains. You said your arthritis in your finger. What other kinds of, is it like for chronic pain or for?
CBD is very good for chronic pain.
Okay. Why is that? And what kind of chronic pains?
Well, it's hard to tell why exactly that is. It's different for everything. But, once again, it has to do with how the CBD is reacting on the cells. The CBD interacts on a receptor on the cell, and that can help minimize pain.
Okay. Like reducing inflammation?
Well, that's another effect. It reduces inflammation as well, and that can help everything. But I mean, as far as chronic pain goes, when that CB2 receptor is activated, then there is a pain relief that goes on. It's a signal to the cell to say, "Hey, it's okay, settle down."
Wow, that's cool. And then again, like so many pain relievers have on the market, we're talking like over the counter or prescription pain relief, have side effects. I mean, even Advil, which I consider like a very minor, pharmaceutical, still has the side effect of ulcers. Or
it's hard on the kidneys.
It's hard on the kidneys. I know people get rebound headaches taking too much Advil. So
Tylenol is the same thing. It's very hard on the liver. And so, but CBD has been shown to have zero effects on those. In fact, it really helps them.
I'm just so surprised that we have this resource and people are still taking Advil or these other medications. I mean, I just took Advil today, actually, and I should have taken CBD. That was probably silly of me, but
it's habit. But that's what pharma wants.
Oh, okay. Well, they got me. They got me this morning anyway. I need to get my CBD out a little more often. Talk to us about anxiety and stress reduction, because that's when you initially introduced it to me, you're like, try this out and see if this helps.
That's exactly why I started taking it.
Okay.
Is for anxiety and stress reduction. I can remember a time in my life 5 years ago when I would actually have to wake up 2 hours early for work just to prepare myself mentally to go do the job.
Yeah. I remember that you'd have to take like a nice relaxing bath.
And I would have physical symptoms like diarrhea every morning. And like I would have to wake up early just to make sure that I was clear to be able to go to work so I wasn't stuck in the restroom at work.
Yeah. And I think also with like anxiety and stress reduction, I mean, just developing those healthy habits along with the CBD, like you've changed your diet, we've been exercising in the morning as a couple. But these things, it's kind of like they all interact with each other. Like once you start making a healthy change in one aspect, like taking the CBD, that helps you get out of bed in the morning and go exercise. And the exercise is also a stress reducer. And then, so it kind of all factors in. Same with the diet, like just eating a healthier anti-inflammatory diet has caused less anxiety.
But when we're anxious and we're depressed,
it's hard to get out of that rut.
Don't want to.
Yeah.
And so, that definitely helps you out of that rut to where you can do what you need to do, for sure.
Yeah, for sure. So I've started taking, as I think I mentioned, CBD at night, right before bed.
Oh, yeah.
Because it helps me sleep better. And I don't really, I've seen you take sleep prescription. What was it?
Absolutely.
Ambien?
Well, I've taken Ambien. I've done the Unisom thing.
Yeah, and I didn't want that for myself. I didn't want the side effects of that, and I wanted something more natural. So I started taking CBD before bed, and my sleep quality is amazing. It just, and it's not like it makes you tired. Like if you took it in the morning, it's not like it would make you drowsy either. So that's why I don't understand why it helps me sleep. Because like if I took Benadryl or Unisom or Xanax in the morning, it would be terrible. Like I wouldn't be able to drive or take care of my kids. If I take CBD, it doesn't really have that effect during the day. Like if I took it this morning, it wouldn't make me tired.
Well, think about it this way.
Okay.
If you're taking CBD during the day and it's affecting every single part, every single cell in your body, and it's elevating the effects of those cells during the day, well, one of the functions of our cells is also sleep. We need our rest.
Yeah.
And so if our cells are also operating at an elevated level while we're trying to sleep, we're going to sleep better.
That's so interesting. I mean, because we're looking at it as something to take holistically for the overall body health. I think when we're looking at pharmaceuticals, they're just addressing that one issue. Like you can't sleep, this pill will like put you out.
Yeah.
And instead of CBD where it's like, you can't sleep, let's look at the big picture, why your body's not sleeping, how your cells are functioning, how we can bring you overall quality of life, right?
Yeah.
Yeah, I think that's amazing. So I take
Also,
it.
with chronic pain. All right.
Yeah.
So, what if your back hurts and, well, okay, so you're going to take some CBD to sleep. I remember when I was, before I was looking at back fusions
Oh
8 years ago,
yeah.
I was actually interviewing surgeons for back fusions. And we can get into that at some point in time. But, if you're taking a CBD and that also helps reduce your pain, inevitably in the middle of the night, I would, turn over. I don't know if you do that. Maybe you sleep in one position, but I like to turn from side to side. I never wake up in the same position. But that turning motion would hurt my back and wake me up.
Mm-hmm.
And so that CBD also helps with the pain, while I'm sleeping or when I had pain, to where I could have a better sound rest. And I didn't have that stimulus of pain when I turned over.
Wow. That's pretty amazing. So it's helping you sleep and be in less pain at the same time. So we talked about a little bit about anti-inflammatory properties of CBD and how it affects people. We talked about arthritis.
It was so amazing. When we talk about arthritis, and let's talk about like autoimmune diseases, like for instance, one lady came in to me with rheumatoid arthritis.
Okay.
Just the other day, she's like, I've tried everything. She's on methotrexate, which is a common drug to give to people with rheumatoid arthritis to help the pain out and help these symptoms not progress.
Okay.
I don't know if you've seen somebody with rheumatoid arthritis after years and years, their hands just look mangled due to the arthritis.
Yeah.
So they take this methotrexate to prevent further decay of the joints.
Okay.
Well, I was doing some research on CBD and found that CBD actually works in the joints on the cells that are causing the inflammation and shuts them down. I mean, how amazing is that? And so I told her, hey, you know what? Give it a shot. See how this makes you feel. And she came in and bought 4 more bottles. She's like, I can't believe how much better my joints feel. And so she's going to start with the CBD and then go and get some x-rays taken by her doctor and see if she can actually get off of her methotrexate and just continue with plant-based medicine. How cool is that?
I mean, that's incredible. I'm actually getting teary-eyed just thinking about how this is changing lives. And it's also really astounding and frustrating that more doctors aren't encouraging CBD if it has this benefit. And
well, it's how they're trained.
Yeah.
It's who runs the medical schools?
Who?
Big Pharma.
Really?
Absolutely.
So you weren't trained on any like plant-based medicine or nutrition or anything in school?
Not 1 hour of my training in school was dealing with plant-based medicine. Not 1 hour.
Wow. That's incredible because it's so healing and we see so much benefit from that.
You bet. So other inflammation issues. I mean, if we can talk about that a little bit. IBS.
What's irritable bowel
syndrome.
Yeah, I was diagnosed with that years ago.
But man, CBD has been found to have marked effects on the digestive system, and to where it can actually function normally and do its thing.
Okay. Going back to how it affects like all the cells in the body and reduces stress, I was told that my IBS, and this was like, I don't know, 20 years ago, was caused by stress. Believe it or not, I had stress.
Yeah.
I know. One of the most stressed out people right here, but not anymore, you guys. Seriously, doing this work, learning about all this stuff, my stress has reduced so much. I'm a different person, don't you think?
She is.
Yeah, better.
She's
better
much easier to live with.
Allison 2.0. So, but they said it was caused by stress. And so if we're saying like CBD helps stress management, then like a side effect of that might be to calm down the irritable bowel.
Yes, through the minimization of stress, but also it does affect the cells and help them function better.
Directly.
Okay. Yep. You bet.
That's amazing. Anything else like that you see anti-inflammatory?
Yeah. Okay. I remember when I, a few years ago when I lost 70 pounds.
Yeah, I remember that.
Yeah, that's actually when I started taking CBD religiously every single day. And, I lost a ton of weight. And it's like, why is this? So I had to go research that a little bit. Turns out in the stressed individual, when we take CBD, it lowers those cortisol levels. And what we know about stress is that causes an increase in our cortisol levels, which causes us to pack on fat.
Yeah. episode, I think 11 is talking about chronic stress and what we can do about it. And I mentioned, I think, that you'd be coming on and talking to us about the benefits of CBD. But when we have a lot of stress, that's our stress hormone, the cortisol. And so you're saying that like taking CBD helps
physically reduces your cortisol levels.
I mean, how does it do that?
Elevating the function of the organs.
Wow.
The other thing that I noticed, and I actually did test this out with blood meters myself, blood sugar meters.
Yeah.
Is it does have a lowering effect on the blood sugar, which is great. And that was my problem, as I was pre-diabetic and I couldn't lose the weight, but I also wasn't quite ready for that change in diet.
Yeah.
But that CBD helped lower my blood sugar to the point where I could actually lose weight.
Wow. So I think back when you were losing weight and people were like, hey, what are you doing? You look amazing. Like the easy answer was CBD oil. And then people were like, oh, I want some CBD oil. Like that's the magical cure. But they didn't realize
There's more to it than that.
There was more to it. You were having a whole
you can't just take that and do nothing else.
Right. You changed your diet. You
started exercising.
Worked less, managed your stress, lots of coaching and counseling. But
the CBD helped.
Yeah, the CBD definitely amplified your progress for sure. Well, and I know that when you have, so it reduces your cortisol, which cortisol, if that's high in your system constantly, it'll cause you to have weight gain, or at least cause it so you don't lose weight, right?
Yeah, any inflammation in the body will cause weight gain.
Okay, and then
so it reduces inflammation.
So by lowering your cortisol levels and lowering your blood sugar levels, naturally that creates the weight loss. That's what you're saying.
Yeah.
Awesome.
Skin health, that's another huge one.
Oh, skin health. I think that's our last one we're going to talk about today is skin health. What have you noticed? Well, you talked about using it topically for the ulcers.
Oh, absolutely. You can use it for a myriad of things. You can use it for acne. You can use it for psoriasis.
Wait. Acne?
Absolutely.
Like you could put it on your face?
Yeah.
And it would clear it up?
Yeah.
Wow. And eczema, have you tried it with any of these things?
Yes, like eczema it's awesome. I mean, rather than reaching for a hydrocortisone, which is a steroid again, you can use CBD in the same way.
Oh man, I feel like a dummy. I just put hydrocortisone on our daughter, and you were probably like, "What the heck are you doing?"
No, I don't judge.
Well, okay, so tell me, she's 8. Would it be okay for an 8-year-old? I mean, is there an age restriction on this?
I mean, not really. I mean, it's plant-based medicine, so I mean, it's not going to. There's no warnings against using it on an 8-year-old.
Okay.
But it's a homeopathic remedy. There's not many guidelines on it because pharma makes those guidelines.
Okay.
So.
Yeah. And I think it's important to note here that like people are going to have different responses to it, and we're not.
And before you begin it, I mean, I really do think you should consult your healthcare professional, although I don't know how much benefit they can offer.
Maybe like a naturopath or an integrative medical doctor.
Naturopath or integrative health.
Yeah.
Absolutely. Yeah, that's a great one.
Yeah, especially if you're trying to reduce or go off of a medication to, do that with the help of.
But I think people are getting more woke to this.
Oh, you just used.
I did. They're getting more plant woke.
I hate that word so much.
Plant woke. So they are. I mean, people are awakening to the idea that, these plants have had some amazing effects and continue to have amazing effects.
Yeah, I hope so, because I mean, I think that's kind of our audience for this podcast, right? Are people that are tired of getting prescribed the pill, and they're looking for something that actually creates permanent change in their life and be more responsible with their health that way. So, Jon, tell us now, I mean, you've studied all about CBD, and I know you've studied a lot about turmeric and spices and so many things.
Oh, yeah.
Where are you headed now in your plant-based medicine journey?
Well, over the last 3 to 4 years, I've been putting a lot of extensive study into the benefits of plant-based medicines that happen to be psychedelic. I know for me, I had my first psychedelic journey about 3 years ago, and was absolutely life altering with respect to my stress and anxiety. Life altering. I understood some things that I didn't understand before. And so I'm actually, since then, I've spent hundreds of hours researching the benefits of psychedelic plant medicine.
Yeah.
So actually next week, I'm going to Costa Rica to continue my research.
Is it next week already?
It is. I can't believe it. So yeah, flying to Costa Rica, and I'm going to do some more research on the benefits of that with a shaman who has been prescribing plant medicine to people for years and years. And so I want to learn what it is that he can teach me.
That's going to be amazing. And then we would love to, of course, hear from you next month on your experience that you had there. I think that's something that's become really, we've had more light shed on psychedelics in the recent years. I mean, maybe even the last months, like more and more people are talking about it. It's been such a taboo thing because because of the 60s. Because of the 60s, these 60s children tripping on LSD. I'm just kidding. I'm not saying my parents were ever on LSD, but that generation,
I might have been. No, they weren't either.
That generation really took it to the extreme.
They took it to the recreational level.
Right.
And these are not recreational drugs. They should not be used recreationally. They are sacred.
Amazing. So I really look forward to hearing about your experience there and sharing that with people here on the podcast. Jon, when we end the podcast, I always talk about what is your why. And you're a doctor.
I am.
And you have the ability to prescribe whatever pharmaceuticals you need to your patient. Why are you so passionate about plant-based medicine?
Oh my goodness. Well, when I was very ill, I went to a doctor and I was prescribed medications that never really got me better. I mean, all they really did was turn me into a repeat customer, and they propped me up and I just got worse and worse and worse. And
more medications
to counteract the side effects of those medications. I was a walking pharmacy. But when I discovered plant medicine, I actually got well. I felt better than I ever had before.
Yeah, I've noticed a huge difference with you. I don't remember when it was, but I know that, and maybe it was after your psychedelic experience, but you just went on a Facebook Live and...
That was after a psychedelic.
Was that? Okay, so about 3 years ago. So you went out was it out by the pool? Okay.
Yeah.
And you had a trash bag full of all your prescription medications.
I think those videos are still somewhere on Facebook.
We'll have to find them. But you just kept, and you went, is Facebook Live? I mean, and all your friends are watching, and you're just like, I don't need this. I don't need this. I'm done with that. And you were just like, this is a new me. Yeah. And you've never looked back. And we still only have maybe 1 or 2 prescription medications in the cupboard for, I don't know, severe migraines for Josie. And
it's that last resort.
Yeah.
Right?
Yeah.
When everything has failed, maybe we consider that. But
right. I know I've noticed with your patients that, you do major surgery on I can't believe the stuff that you do. And you're just like, go home and rest and put some ice on it. And you're very slow to prescribe to your patients, probably because of the experiences that you've had, but also because you understand the way the body heals.
And I don't prescribe any more than about a week, maybe 2 at max. But no, I don't believe in medications, chronic, medications, taking them for forever. Absolutely not.
Right.
I have my limitations.
Yeah. And I don't think that's ever was the intention for a lot of these medications, but that's kind of just what happens.
I mean, you think about it, like last year, America spent $600 billion just on pills.
Right. And I think, like we've talked about before, they make a lot of money on sickness, not on wellness.
Yeah, so if they had a cure, then they're going out of business.
Right. That they get a lot of money off repeat customers.
I don't like it.
Yeah, I think most people here could agree that prescriptions don't usually heal. They don't usually make us better. Well, I mean, maybe sometimes, but for the most part, a lot of side effects and a lot of continued dependency on them. And
the biggest thing I ask my patients to do is slow down.
Yeah.
Slow down. Ice that. Use
right.
other homeopathic remedies. And
right.
then when those aren't working as a last line of defense, let's take a prescription medication. And most of the time that's just an antibiotic.
So it doesn't mean that you don't prescribe. It just means you're using it as a last line of defense.
Correct. Yeah.
And better to listen to our body, get the rest, put it on ice, let your body heal. Be patient. I think that's a lot of illness that we have, like whether we're fighting a cold or whatever. It's like just rest.
Yeah.
And instead of going for the quick fix.
And you know what I love to hear is when a patient will come to me and I'll say, you know what? Our society says I can prescribe you this, for instance, like a painkiller, for instance. And they tell me, you know what? I'm just fine with something else like an anti-inflammatory because I get such bad side effects from the pain pills. That just warms my heart that patients are listening to their bodies and understanding these things just don't make them feel good. It makes them forget that they have pain, but it doesn't make their bodies feel good in the long run.
I remember you would always say it would just prop me up so I could keep working and keep pushing myself beyond my limits.
Yeah.
So yeah, good to pay attention to your body and how it reacts to all of these things. And Jon, I'm so looking forward to this trip to Costa Rica and hearing all about it. I think that is going to really open some eyes for some people out there that have a stigma, probably a lot of people, a stigma against psychedelics, and just try and share your experience there and how beneficial that it is.
I'm so excited.
Yeah. All right. Thank you so much for joining us today. I love this about CBD. This has been eye-opening, hopefully, for a lot of people. Again, we do sell it. So if you're interested, you can go to petersonfamilycoaching.com.
And this isn't something that like we're getting from somebody else.
Jon has mixed this himself.
Yeah. I mixed it up myself. I know what we're putting into it.
Yep. All right. See you next time. Thanks to everyone for joining us. Bye-bye. I hope you found value in what you heard today. If so, please follow us and go give us that 5-star rating. It really helps us reach more people that need to hear this message. Also, if you're ready to make changes to your health and well-being, go check out our Fat to Fuel program. Our coaching program empowers you to make healthy changes to your life one step at a time. Go to fattofuel.com or click the link in the show notes. We hope to see you there.